Okay, let's get started. Good morning if you're in Ontario, and good afternoon if you're in Baden-Württemberg. My name is Harald Bauder. I'm delighted to welcome you on behalf of the Ryerson Center for Immigration and Settlement to the seminar titled Regional and Municipal Integration Policies and Practices During COVID-19, Ontario and Baden-Württemberg Compared. The two provinces, the province of Ontario and the Land of Baden-Württemberg have been partner provinces for quite some time now, I believe 2006. And we're looking forward to engaging in a new and sustained dialogue on the wider topic of integration. So this will be our first seminar. Hopefully there will be others on this topic. So we're focusing today on migrants and refugees who lack secure status or find themselves in other vulnerable situations. And we are interested in particular how local and regional contexts have responded to and coped with the situation of these migrants and refugees. There are some questions of discussions that we threw out to the panelists, and they include: in which way has the pandemic affected local migrants and refugees who are in precarious situations? How have municipalities and regional levels of government responded and cooperated in this regard? What have we learned from the past 18 months of the pandemic? And how can we improve in a post-pandemic world? And are there creative formats emerging to deliver services and offering security? In other words, are there opportunities that emerge through this situation? And now I'd like to pass it on to one of my co-organizers, Professor Dr. Birgit Locher-Finke, please.
Thanks, Harald. Sincere welcome from Baden-Württemberg to all panelists and participants of today's symposium. I'm the head of the Department of Integration at the Ministry for Social Affairs in Baden-Württemberg, and I'm also part of a team that organizes the Forum on Migration and Integration in Baden-Württemberg, bringing together scientists and experts in the field. Both the Forum as well as the Ministry are among the sponsors of the symposium today. Well, first of all, I wish to thank Harald Bauder, who has been the main initiator of our exchange today. And I have to mention that we had the unique opportunity to actually meet in person in Stuttgart this summer, develop some ideas on this Ontario Baden-Württemberg Symposium together with Professor Vera and Professor Brown, who are also part of the Migration and Integration Forum. I think the topic is well taken, and you have already mentioned the key questions that are leading through the symposium today. I think it's quite important that we exchange insights and experiences concerning these questions. We need to enhance our knowledge, and we need to develop new approaches and ideas for the future. And I think that's the context that we actually need to learn from each other. And so we're very happy that we can have this symposium today, and I'm really happy that we're able to have the panelists that we have here and to exchange our insights from both sides. Thank you.
Okay, and next we have invited the Consul General of the Federal Republic of Germany here in Toronto, Thomas Schultze, to give a welcome address. He can't be here in person, but he offered a recording, which we will play now.
Hello everyone, to all the participants and viewers who have tuned in for today's virtual symposium from Canada and Germany. My name is Thomas Schultze. I am the German Consul General in Toronto. It is my great pleasure to welcome you all to a new edition of the Ontario Baden-Württemberg Symposium, a wonderful tradition by the two partner provinces to intensify exchange on a policy level and explore what both jurisdictions can learn from one another. My apologies that I cannot attend as I did last time, but in-person events are back and I'm committed to take part in a few today. A warm welcome to the panelists, Vera Dodic and Professor Hudson, who will be sharing perspectives from Ontario, and Ayse, Özbabacan and Professor Claudia Diehl, who join us from Baden-Württemberg in today's exchange of ideas. And, of course, a heartfelt thank you to the organizers, Professor Harald Bauder, hi Harald, Professor Birgit Locher-Finke, Professor Karl-Heinz Meyer-Braun, and Professor Reinhold Weber. This is the second such symposium in a virtual format, and you deserve so much credit for your hard work in keeping the academic exchange between Ontario and Baden-Württemberg alive in these challenging times. I firmly believe this is exactly the kind of exchange and cooperation we need to make us stronger together and more resilient to crisis in the future. We should not forget about all the students who missed 2 to 3 semesters of student life, had to study from home, and sometimes under difficult circumstances, or could not get to their desired place of study at all due to travel restrictions. Even now, students here in Toronto willing to take part in exchange programs still don't know whether their university will allow them to leave for this semester abroad in January. I know that there is a great deal of frustration, and we are talking about the young generation, the future of our societies. While we are very much hoping that we're on the path to leave the COVID pandemic behind us, it is undeniable that it is a crisis that has affected all of us over the last 2 years. And it is equally undeniable that some groups were far more vulnerable to its effects than others. And these were often the people who already were in a more precarious position. I thank you for giving us this opportunity to shine a spotlight on another issue that has not yet received much attention in the public discourse of the pandemic: how it has affected refugees and migrants, and how public administration at the regional and municipal level has reacted to this. Many issues come to my mind: ensuring access to healthcare, including COVID testing and vaccinations, and overcoming language and cultural barriers to provide vital information on the pandemic. The difficulty in social distancing for new arrivals, the challenges to provide basic administrative services to people who sorely need them during lockdowns and office closures, and the ability to continue providing language training in virtual formats. The vulnerability of migrants on the labor market when they disproportionately work in precarious conditions to begin with. I'm sure these and perhaps many more issues that I haven't even thought of will be discussed over this symposium. And as much as it is important to exchange experiences on what went well, I find it even more critical to learn what did not, as these are exactly the kind of systemic shortcomings that we need to address for the sake of doing better for the people who need it. I look forward to today's debate and hope for valuable insights. With this, I would like to give the word back to you, Harald and Reinhold. Thank you so much.
So we wanted to give the audience a brief introduction to Ontario and to Baden-Württemberg. So I will cover just a few slides on Ontario, some of the facts and figures, and then Professor Reinhold Weber will do the Baden-Württemberg part. So just some of the basic facts that you had, that people in Germany have a basic understanding what Ontario looks like and what the differences might be. In terms of inhabitants, we're having around 14 million, approaching 15 million people by now. Ontario is very large in comparison to Baden-Württemberg, almost or more than 1 million square kilometers. So the population density overall is quite low. We're looking at 13.4 people per kilometer, but you have to see that much of the population of Ontario is concentrating in the south, in southern Ontario, especially in the Greater Toronto area. Toronto is the largest city. Toronto proper has a population of just under 3 million people. And the GTA, so the larger area with the municipalities of surrounding Toronto, has roughly close to 7 million, a population of 7 million. The share of foreign-born population in Ontario has been increasing over the years, and currently, or in the year 2016, that was the last census, stood at just under 30%. In terms of the country of origin of the foreign-born population, on top we have India and China, followed by the Philippines and the UK. Other significant immigrant populations are Pakistan, Italy, Jamaica, as well as Sri Lanka, United States, and Hong Kong. And since we're talking about cities, I also wanted to share some of the information on cities very briefly. The these are all the cities, the major metropolitan areas, census metropolitan areas in Canada. And you see that within the Canadian context, Toronto has by far the highest share of foreign-born population. So it's close to 50%. And I understand that in Toronto proper, the municipality, it's even higher than that. Also, to the very right of this graphic, you see two other municipalities or greater metropolitan areas in Ontario, the Kitchener, Cambridge, and Waterloo municipality or census metropolitan area, and the Windsor CMSA. And they also have a share that's approximating a quarter of the population that is foreign-born. And I'm just going to hand it off over to Professor Weber to give you a bit of a context of Baden-Württemberg.
Well, sorry about that. Well, welcome also from my side and on behalf of the State Agency for Civic Education in Baden-Württemberg. And I will just give you, as well as Harald did, some short information about Baden-Württemberg, also with some facts and figures. Baden-Württemberg is located in the southwest of Germany, bordering France to the left, to the west, bordering Switzerland and Austria in the south. It is often called the big state, a big state with a lot of small cities, small towns. That seems to be a difference to Ontario. As you can see on this map, we don't have this dominant center, one large city, but we have a lot of towns and cities in a middle size. And the political center, of course, is Stuttgart, but Stuttgart has about 600,000 inhabitants, so quite a difference to Toronto. Politically, we have the state level of Baden-Württemberg, below it the individual counties, and many self-confident cities and municipalities, which are largely independent political level in Baden-Württemberg. Traditionally, Baden-Württemberg has been characterized by immigration, not at least because it is a very strong economic location in Germany. In a comparison of the German states, it has one of the highest percentages of people with a migration background or people without a German passport. The figures you can see, I hope. Yeah, you can see the figures for the foreign population. That means people without a German passport, as I just said. The largest foreign population groups are also traditionally people from Turkey and Italy, from the former Yugoslavia and other Mediterranean countries. And since the eastward expansion of the European Union at the beginning of the 20th century, from Romania and Poland, and since the large migration movements of the years after 2015, especially people from Syria. This chart shows you how global refugee movements have affected Baden-Württemberg over the decades. You can see a peak at the beginning movement at the end of the 70s and the beginning of the 80s. First peak at the beginning of the 90s with the dissolution of the Eastern Bloc, and a clear peak with the migration movements, with the global migration movements of 2015 and the following years. This chart shows you that immigration decreased during the pandemic, as you can see on the right side of the chart, but it also shows how heavily Baden-Württemberg is dependent on immigration if it wants to maintain its economic strength against the backdrop of demographic change. So you can see there are waves of immigration, and some years at the beginning, in the middle of the 2000 years, that the immigration decreased heavily, and we are now during the pandemic at a point where it is also quite on a low level. Well, so much for now for my brief information about Baden-Württemberg. Thank you for your attention, and I will close my screen. Thanks a lot.
All right, thank you very much. And we're going to move on to the main part of our symposium today. We have 4 panelists, which I will introduce, or I will introduce the Ontario panelists first, and then Birgit is going to introduce the Baden-Württemberg panelists. But just about the format before we do that, we have asked the panelists to give short opening statements and remarks about the situation that they're familiar with in Ontario and Baden-Württemberg, and then we have time for discussion. First, a round of discussion among the panelists themselves, and then we have also an opportunity for the audience to ask questions, and we're going to use the chat box for that. So our first presenter, representing the City of Toronto in Ontario, is Vera, who is the manager of the Toronto Newcomer office of the City of Toronto. Then following Vera, we have Dr. Graham Hudson, who is an associate professor, and I understand this associate dean in our new Lincoln Alexander School of Law here at Ryerson University. And then I'm going to hand it on to Birgit to introduce the Baden-Württemberg panelists, please.
Yeah, thanks, Harald. Thank you very much. I would like to introduce Claudia Diehl, Professor of Sociology at the University of Konstanz, and Ayse Özbabacan, Deputy Director of the Department of Integration Policy at the City of Stuttgart. Thanks for being here today, and let me say a few words to each of them. Professor Diehl's special focus is on migration and ethnicity, as well as on microsociology. She has been part of larger research projects, and she's currently working in a project focusing on female employment after migration. She has published in numerous journals on issues such as women's work and family patterns after migration, migrants' welfare, state attitudes, refugees, and their early integration in society and education, and on many, many other topics that I cannot present to you today. Ayse Özbabacan is responsible for the implementation of the integration policy concept, the so-called Stuttgart Pact for Integration, with a focus on enhancing intercultural competences of the city administration, and among other issues, also a focus on women and migration. She has also been active in various international contexts. For example, she has been the coordinator of the European Cities Network to promote the exchange of best practices with regard to local integration policies among 35 European cities. She's also involved in transatlantic activities with the German Marshall Fund. Again, thanks for being here. Thanks for sharing your insights with us.
And I should add that it's not only academics, of course, that we invited to the panelists, but we really wanted to connect the academic perspective with the practitioner's perspective. So in this case, in an Ontario case, Vera has lots of experience as a manager of the Toronto Newcomers office in the city of Toronto, and then Graham has the academic view, who has conducted a lot of research in Ontario, but also many other municipalities in Toronto, in Canada, as well as the United States. So I'll hand it over to Vera, please.
Thank you. Thank you very much for inviting me to be a part of this important panel, and even more so for raising the issue of the impact of COVID-19 on migrants and refugees. They faced some unique challenges during COVID-19, which has put them at a higher risk than the rest of the population. And Consul General mentioned some. So this includes living in circumstances where social distancing is not possible, or not having access to healthcare and social services in Ontario. Many worked as essential workers and some of those with precarious or even no immigration status. Once the lockdown measures have started in March of last year, that then created additional barriers for some members of the migrant and refugee population. For example, once the non-essential businesses were closed, many of them were left without work, while at the same time they did not have access to financial assistance, to social assistance. At first, the City of Toronto learned about their difficulties through anecdotal evidence. There's hundreds of agencies that we work very close with across Toronto, and we were hearing from them about the difficulties that migrants were facing. In May of last year, Toronto Public Health became one of the first public health units in Canada to start collecting information on ethno-racial identity and income from people who were COVID positive. Once we had this data, we were able to confirm the impact, including on immigrants and refugees. So it was confirmed that although migrants had lower testing rates, COVID testing rates than Canadian-born and long-term residents, they had a higher percentage of positive COVID-19 tests. Also, data confirmed that social factors such as living conditions, lower income, crowded housing, lower education, not being able to speak neither of the official languages, that these factors were associated with lower testing rates and higher percent positivity rates. We were also able to see through data that the majority of COVID-19 cases in healthcare workers and long-term care home workers were in fact in immigrants and refugees, many of whom were women. I'm very happy to say that from the start of the pandemic, the city took a special interest and special focus on migrant populations and on all of the populations that were hard hit by COVID-19. So very early on, in March 2020, the city established a multi-partner response and across the city response, cross-corporation response that was called, that is called, because it is still running, TO Supports COVID-19 Equity Action Plan. And the goals of this plan have been to stop the virus spread and to deliver immediate emergency support to the neighborhoods and populations that have been hardest hit by the pandemic. The plan identifies 10 specific action areas that are all based on the social determinants of health, and the plan has been evolving and adjusting as the circumstances changed. Many of the programs and services were implemented within days and were completely new. Because we don't have a lot of time today, I will just mention a couple of the specific activities that are directly related to newcomers. Or to migrants. First of all, the community coordination plan that was established as part of this support TO plan is a partnership of more than 400 local agencies in Toronto, and they have been organized in 13 different clusters. 10 of these clusters are based on geography and they cover different areas of Toronto. And the remaining 3 clusters include a cluster for citywide agencies, a Black Resilience cluster, and finally a newcomer cluster. These clusters have been meeting throughout this period and they are co-chaired by the City and United Way. And in some cases, like the case of the newcomer cluster, with a community partner. Through this community coordination plan, we were able to reach out all of the areas of Toronto and reach out the populations that were very hard hit by the pandemic. More than 15.5 million in donations were distributed through the clusters. And in addition, 10.2 million was secured by the city in emergency funding and was distributed to 80 community agencies serving the most vulnerable residents, including newcomers and refugees. I would also like to mention a special program relevant to only to migrants, and it is called Temporary COVID Emergency Support Fund. We partnered with FCJ Refugee Center to distribute the assistance. It is the financial assistance to those that are either required to self-isolate or are COVID positive and are not eligible to receive neither COVID benefits nor the provincial income assistance. And in the greater majority of cases, those are people without status that live in our city. In addition, the city provided 5.5 million in funding to coalitions of community agencies to establish vaccine engagement teams. And some of these vaccine engagement teams are focused only on migrants and refugees themselves. And in all of the vaccine engagement teams across the city, coincidentally, many of the people that were recruited to be the ambassadors for this community vaccine outreach are migrants themselves. In addition, the city also funded 2 groups of agencies that are serving migrants to provide special support to people without OHIP cards, without health cards, to book vaccine appointments, because otherwise it was very difficult for them to do so. And thousands of people access this service. In addition to this, the city very actively advocated for intergovernmental cooperation and response. And some of the requests to the other 2 orders of government that I would like to highlight is to, first of all, provide adequate paid sick days and income supports to all those who need to isolate but cannot afford to do so. Then also request to the provincial government to extend eligibility for the Ontario Works Emergency Assistance Benefit. And then finally, earlier this year, the City Council requested the federal government to introduce regularization opportunities for those that live in Toronto without immigration status. There is so much more that I could share. It's been an extraordinary period so far, a lot of learning, and I will look forward to the questions to share more. Thank you.
Okay, great. Thank you, Vera. I'm sure everyone has lots of questions for you, but we're going to move on first to Graham.
Well, thanks, Harold. And I certainly have lots of questions. That's really informative and exciting, Vera. Hi, everyone. And thank you for welcoming me here. It's been some time since I've participated in a conference. I'm a bit rusty being home with 2 kids during COVID, but we'll see what I can manage to do. What I thought I would talk about today is just to draw on a little bit of the experiences that I've had over the past 1.5 years working with migrant rights organizations on the access to health piece in the province of Ontario. And some of the interpretations that I've gotten from that advocacy and the barriers, I think relate to the themes of this symposium. And I'd like to kind of compare in some way the way in which federalism has shaped COVID responses. Being so close to the United States, Canada has picked up some bad habits, I think, with respect to federalism and this idea that the 2 levels of government have their own exclusive spheres and don't really get along all that well. That's not what I've been seeing, and that's not really what's going on in this field. I think what we see is actually a lot of shared jurisdiction over core policy areas, including health and labor, education, social assistance. And what I want to kind of focus on here is the implications that has for the collection and sharing of data. And what that means for either being able to access these social services or for specifically non-status migrants, how that can actually create some degree of barrier. And so I thought I would just provide a little bit of a background to the role of data in the sanctuary city model that we have here in various cities in Canada, very briefly, but then to look at how COVID data collection works in this larger context of federalism. And then to talk a little bit about how privacy of rights of non-status migrants relate to that data collection and sharing, and how maybe this can help leverage greater access to healthcare in the short term and the long term. And so in Canada, the term that is often used in sanctuary cities is access without fear. And the subject here is of course, the precarious or non-status migrant, that there should be a right to access social services without fear of being reported to the CBSA, our federal border enforcement agency. But I think fear also relates to governments. Each level of government is afraid of something when it comes to policy responses to access for non-status migrants. And I won't talk about the fear of the federal government or the provincial government because that'll take too long. But one of the things that cities have to be afraid of is first and foremost their own interests. And I would kind of look at the political economy of sanctuary. Cities in Canada lack serious political and fiscal independence. And they coordinate quite closely with provincial and federal governments, especially in the areas of settlement and integration. And so cities have to be very careful when they're rolling out sanctuary policies to pay heed to their jurisdictional boundaries. So you can have shared jurisdiction, but there's always the latent conflict that they have to be aware of. But I think the more pressing fear is that any information that's collected in the business of implementing sanctuary policies, that data can eventually find its way into the hands of the border officials. And so there's a reticence within all of the sanctuary cities in Canada to collect data that might identify non-status migrants. And this creates some serious practical problems for policy implementation and policy review. When you don't really know what the numbers of the non-status population are, or what the demographic details, age or gender or sex or country of origin, it makes it very difficult to calibrate policy responses and to evaluate the effectiveness of this. And so this is really exacerbated in the context of COVID response. Most health responses to COVID are handled by the provinces. And they cut across a range of different matters. There's COVID testing, there's COVID vaccinations, but there's also a bevy of emergency measures that would relate, for example, to businesses and labor, schools, transportation, etc. And all of these different policy areas depend on the collection of data and its circulation to relevant local authorities and the provincial government itself. And of a particular note, what I'd like to focus on is the collection of data concerning vaccinations. And this is all held in a central database in Ontario, and each province is the same. And this information, when somebody gets a vaccine, you don't have to have a health card number in Ontario, but it's asked for. And there's a certain file that's created that documents when you've got your vaccine so that you can use it for your vaccine passports, et cetera. And this helps the government identify vaccination rates, what the hotspots are, when they can lift restrictions or impose restrictions. And so this data is also then sent to law enforcement agencies, including bylaw officers, police, and various others, so that they can enforce COVID regulations. And so looming in the background of this, what would otherwise seem as a normal response to COVID that we see in every jurisdiction is the question of, is this information being shared with the federal government? And if it is it finding its way into the migration quarters? And it's really difficult to tell exactly how much data is being shared between provincial and federal governments on this point, but the consensus seems to be that not very much. Provinces don't want to share data. The provinces say it's because of privacy law, but I think really what it is that there's a concern about sharing a lot of data that might embarrass them. There was a lot of conflict, especially in Ontario, about who was responsible for the failure to implement vaccine programs in the first instance. And the federal government blamed the provinces, the province blamed the federal government. And so there's a little bit of conflict here and an attempt by the provinces to keep this information to themselves. That being said, it's very clear that the CBSA is active in trying to get information. And so, for example, police, like I said, have access, or at least historically did have access to this health information. And police are also the number one source of local information to the CBSA on non-status migrant populations and whereabouts. And so what this is creating is a sense within the non-status migrant community and the migrant rights community that it isn't safe to access healthcare. It isn't safe to get a vaccine unless assurances are made that information will not be collected, or if information is collected, it won't be shared with the federal government. And so I'll just kind of very briefly talk about what the legal landscape is, just to kind of set out how not useful it has turned out to be. at least in the short term. So under provincial privacy legislation, we've looked at whether it applies to non-status migrants, and it turns out it does officially. If you look at provincial privacy legislations across the country, not just Ontario, but BC or Nova Scotia or Alberta, all of them describe rights that the individual has, and there's no restriction of the term individual to Canadian citizen or permanent resident. There's no qualification that the person who has privacy rights has to have some sort of immigration status. And more than this, immigration status is actually considered personal health information, because personal health information is defined as anything that is collected, used, or disclosed in the context of healthcare. So if an individual either verbally or in writing discloses that they have no immigration status, or if a physician or other healthcare practitioner finds out or discerns that the individual lacks status, let's say because they don't have an OHIP card and a health number card, that immediately becomes protected under privacy law. The difficulty is that this legislation creates a range of exceptions, including court orders and discretionary sharing. And anecdotally, we've been hearing that there are more than there should be healthcare institutions and practitioners who have been calling the CBSA for a wide range of reasons, and that this has led to a reticence among the non-status community to access vaccines. And it turns out also good news is that currently in Ontario, as of actually March 2020, all medically necessary healthcare is available to every single person in Ontario. Historically, it was restricted, publicly insured healthcare was restricted to an individual who either was a Canadian citizen or permanent resident, or who had a very narrowly defined immigration status. But as of March 2020, the provincial government in Ontario stated that anyone can access publicly insured healthcare if it's medically necessary, and they don't need to present an OHIP card. The government will compensate a hospital or a clinic for any of the healthcare that's provided. In the intervening months from then until now, it's been clear, as Vera pointed out, that the vaccination rates are much lower, and the COVID implications have been greater in migrant and racialized communities. And lots of reasons for this. We can talk about the online booking systems and how that was a problem, or the perceptions of physicians or other healthcare practitioners of the deservingness of non-status migrants to what they're legally entitled to. But the biggest issue really is this issue of privacy. At least as far as my experience is involved in advocacy, that non-status migrants can't be sure that their personal health information will actually be protected, that it will actually not be shared with the federal government. And so I'll leave it there just to say that looking to the future, I see this problem is getting worse. I mean, it's amazing what the city of Toronto is doing, but that's the high watermark. That's not happening really anywhere else in the country. And things are going to get worse because we're starting to see vaccination passport policies, where residents now, if they want to access a gym, a movie theater, a restaurant, any public place really, they have to show proof of vaccination as well as government issue ID to demonstrate that they are the one who's been vaccinated. And for a non-status migrant, even if one can get proof of vaccination, they obviously lack a government ID. And so I'll leave it there, but yeah, I'll just leave it there. Thank you.
Well, thank you very much. At that point of time, I would already have lots of questions and lots of remarks, because the issues on the Canadian side that we're not so much discussing on the Baden-Württemberg side, particularly the legal questions and the non-status migrants. But that's not my job at the moment. What I have to do is to actually lead over to the Baden-Württemberg panelists. And I guess the idea is that we first listen to the inputs and presentations, and then we are able to discuss the panelists among each other and also the audience. So I would like to ask Claudia Diehl to begin with the presentation and input. Thanks for being with us.
Yeah, hello together. It's really nice to be back, at least partly and virtually in Toronto, that I miss a lot, especially now with Halloween coming close, and we had to leave so abruptly in May last year. So nice to see you all. And I hope I won't be a disappointment, because I will neither talk about vulnerable groups nor about Baden-Württemberg, because this is just not what I have data about, but my input will be on a much more general level, and I hope it's still interesting. Yes, I will briefly say something on ethnic inequality in Germany. I was not that sure about the audience, so maybe that's something you all know, so it will be very brief, and then say something on the impact of the pandemic on ethnic inequality. And then, unfortunately, I cannot say a lot about the role of local integration policies, but Ayse Özbabacan is really has this great knowledge about what cities are able to do, and I'm really looking forward to her presentation. Yeah, so what we see in Germany in general, and that's of course also the case in Baden-Württemberg, that no matter which groups we look at, so whether we define minorities by nationality or migration background, what is very common in Germany to do this, by their ethnic or religious belonging, by parental place of birth, we really see substantial disadvantage on many dimensions of inequality. So in the educational system, migrants have lower competencies, they perform worse in tests, their educational attainment is lower, their dropout rates are higher. On the labor market, the labor force participation is low, especially for female immigrants. Even in the second generation, unemployment is high, income is lower, occupational status is lower. Similar pattern on the housing market. And when we look at the factors that explain this, what's really making the biggest difference by far in the German context is the selective immigration of low-skilled immigrants, big difference to the Canadian context. So still the legacy of the immigration of many low-skilled so-called guest workers in the 1950s till 70s is really, it's very strong. It still shapes the overall educational composition of the migrant population, in the first and in the second generation, even though ever since migrants' educational degrees really have increased, and by now the share of individuals coming in with tertiary education is really higher than among native Germans, but so is the share of individuals coming in with very low levels of education. So it's really this polarized educational distribution. There's a lot of debate in the public about the role of cultural factors and ethnic discrimination, and I think that can be summed up very briefly, that both factors matter to a certain degree. So for instance, culture, ideas about female employment really matter when it comes to explaining female migrants' very low labor force participation. Ethnic discrimination is, many studies show that this plays a role in the German context, but by now there are really some interesting comparative studies, and in the German context, discrimination on the labor market does not really seem to be the most extremely relevant factor. Yeah? It's moderate as compared, for instance, to France or the US. So the key point is educational resources are really what makes a big difference when it comes to explaining who is disadvantaged and who isn't. So the most important challenge for newcomers is really the acquisition of resources that are necessary to succeed in the educational system and on the labor market. And that was on a really good track for the refugees who arrived in Germany in 2015 in large numbers, just as they did in Canada. Okay, so the impact of the pandemic, it's really interesting to hear what you know, which data you have, how you solve these issues, information on vaccination, all this in Ontario. In Germany, we really have a strong lack of data. So we don't even know, for instance, whether we know, of course, that migrants are at a higher risk of catching an infection because they have a higher exposure at work, they live in dormitories and so on. But there is not really reliable data. And the same is true when it comes to the vaccination progress. We really do not know this, because when they collect information on vaccinations, even though Germans have this reputation of being very thorough people, this is not really the case, if it ever was any longer. So migration background, ethnicity, nationality is not measured. So you may have heard about the puzzle that we don't really know how many individuals are vaccinated in Germany in general, but we certainly do not know how many immigrants have been vaccinated, or what the differences in vaccination rates between natives and migrants is. They probably have higher mortality rates, but again, we know very little about this. There was an interesting debate. One guy from the Robert Koch Institute once mentioned that he was told by a doctor that migrants, the intensive care units are full of migrants, and he kind of insinuated that this is because of cultural factors, their cultural background. They do not really keep their distance, and the families stick together and all this. But I don't think that this is, just given the age structure of migrants, it seems very unlikely that they that the statement he made was true. And definitely the main reason, if they have a higher mortality rate, is that they are just more vulnerable, especially in terms of their labor market participation. Yeah, they were overrepresented in the labor market sectors most affected by the pandemic, like in the hospitality industry. And migrants were especially affected by school closures and distance learning measures. The parents have fewer resources to help their children because they have lower levels of education, lower language skills. They are less likely than students with native-born parents to have access to a computer or internet at home, or to a quiet place for study. There are first studies now showing that there was a stronger increase in unemployment among migrants than among native-born between 2019 and 2020. When it comes to their sociocultural integration, language and integration classes have either been stopped or they have been moved online, which of course makes learning much harder, especially if you don't have a quiet place to study. We all know how hard it is to really focus and concentrate at home. Yeah, so what I'm really interested in is what was the indirect impact of the pandemic on migrant sociocultural integration. And I talk about the indirect impact because it's not the direct impact. I would say it's a health impact, and the indirect impact is the impact of the containment measures on migrant sociocultural integration. And the interesting question is how the pandemic affected migrants' social integration, their linguistic, and maybe even their identificational integration. That's very difficult to assess because the treatment of the pandemic affected all migrants alike, of course. And what we would really need is contrafactual information, like how would the integration trajectories have looked like without the pandemic? And of course, this information is unavailable. But we were in a rather lucky situation here in Konstanz, my colleague and the colleagues from other universities who were involved in these projects, because we had just started a new research project funded by the German Science Foundation in 2018. And in this project, we conducted a large survey with recent immigrants who came to Germany rather recently. And the idea was to study early integration trajectories of the refugees who came in 2015 and compare them with other groups who are important source countries for immigration to Germany. The groups we looked at were migrants from Poland, Turkey, Syria, and Italy. And luckily, in this project, we used the same questionnaire that we had used in another big research survey project called SKIP that started in 2010. And these two projects really had a very similar research design. We sampled from local population registers, so it was a really good, reliable sample. We used more or less the same survey instrument, and we surveyed migrants after a few years in Germany and then again 1 to 2 years later. And our idea was that we can use this lucky situation that we have this very unusual data availability to look into the impact of the pandemic on migrant socio-cultural integration trajectories. So what we do methodologically is we built comparable twins of recent migrants from Poland and Turkey. And the twins, so we match one migrant from Turkey who immigrated before 2009 and one migrant from Turkey who immigrated before 2019. And we match them on variables that we know are very important in explaining integration trajectories. Education, age, gender, prior stays and experience in Germany. And the idea is that the differences we still see between a Turk who came before 2009 and a Turk who came before 2019 in his or her integration trajectory, that's due to the pandemic. Yeah, that's a bit complicated to explain. And I won't go into the theoretical arguments that we had for looking at these dimensions here. But what you see very briefly is that in terms of language, the blue dot, time spent with Germans, time spent with COs as other people from the country of origin. And in terms of perceived discrimination, we really see that the immigrants that experienced the pandemic show a less steep increase. Yeah, whereas interestingly, in terms of their political interests, they show a steeper increase. So I can show this here in greater detail just for the language skills. And I really want to emphasize these are very preliminary results. We're really working on this right now. And this is nothing to kind of, we have to recalculate all this. And but what we see pretty clearly here is in the upper figures, what you can see is that in the SCIP study that started in 2009, the increase in language skills between the first and the second survey, this is what we call wave 1 and wave 2. Those are not pandemic waves. It's a bit unfortunate to use this wording. The increase that we see between the two waves in the SCIP project, in the earlier project, is steeper than the increase we see in the ENTRA survey. And then if we match them, this is what's included in this full model, we see that the gap really increases. That means basically it means if the migrants who arrived later, that the migrants we surveyed in the ENTRA project, if they would have had the same characteristics as the ones who arrived earlier, who were basically less educated, the difference would be even more pronounced. Yeah, basically their language skills would have decreased between wave 1 and wave 2. So we really see that the pandemic had, especially when it comes to language skills and to migrants' social integration, which is ties to non-immigrants, the pandemic really had a negative effect on their integration. It looks different in the field of political integration, which makes sense in a certain way. So there is this idea that in times of crisis, people kind of move beyond their differences and focus on what joins them. There's the idea of a rally around the flag effect, as political scientists call this. Okay, so that's, I'm coming to an end. Of course, what's worrisome about these results is that this will probably, what we see here, that the pandemic negatively affected newcomers' language skills and their social context with German, that this will negatively affect their education in the educational system and on the labor market, even, for instance, if the labor market bounces back. So in addition to the fact that migrants lost their jobs because hotels and restaurants were closed, when they reopen, they will have the problem that their language skills did not make the progress they would have made without the pandemic. Unfortunately, and I hope that's not too disappointing for you, these analyses are impossible for more vulnerable groups like refugees because we did not survey them in 2009, because we only looked at 2 groups back then and only incorporated newer, more recent immigrant groups in the later project. But of course, it's not too brave to say, well, we really expect that the effects that the refugees experienced were even more negative because they just have harder starting conditions. So where do the local integration policies come in? That's very obvious. Language acquisition and social integration happen on the local level. So I think it's really important to invest now in educational programs, to take care of mental health issues that also, I mean, many of them were in therapy. I don't know what went on in this area, but I think it's really time now to try to make up for what happened during the pandemic. Thank you.
Thanks very much, Claudia Diehl, for this very, very interesting presentation, and thanks for that we are able to basically see your work on research in progress. And I guess there are many things to discuss, but before we do that, I would like to give the word to Ayse Özbabacan, coming in with the experiences at the city level, and I guess there is a good connection to what Claudia Diehl has presented in the end. So please, Ms. Özbabacan.
Thank you very much, Ms. Locher-Finke. Yes, and thank you to Ms. Diehl, of course. So I will touch upon that, what actually local integration policies can do in such a crisis, and how important they are. So I can confirm what Vera said, what Graham said, of course, the issues you touched upon. What did we do back in March 2020 when we had our lockdown? So as Ms. Locher-Finke said, our integration work is based on the integration policy concept, which is called the Stuttgart Pact for Integration. So we work closely together. I mean it's the politics, the administration and civil society, immigrants and Germans. And I can tell you that this year we are celebrating 20 years of the Stuttgart Pact for Integration, so our successful integration work. And in the beginning of the crisis, we said, well, everything has closed down. Integration is people work. And if we cannot bring the people together, we have to think about other approaches, how to reach out to the people. So one important approach was to communicate to all people so that they all are informed about this virus and the consequences. Very important partners of our integration work are the immigrants and their associations and organizations. So we actually involve them from the beginning on into our integration, well, COVID-19 initiatives and programs, which means really to communicate the information we had at that time via social media in different languages, via videos, short videos. To give you an example, 4 years ago, we received money from the city council to promote the empowerment of refugees, which means to really empower the refugees to take ownership of their own integration and to use their resources and competences and talents to shape our society. And we had actually started great empowerment projects, developed by refugees, for refugees and for the society. And out of a sudden, we had to stop everything. But then we involved them and they started to do videos in the different languages, Arabic, Kurdish, Farsi, to inform refugees on the recent COVID-19 informations we had at that time. Language is another very important issue. You all have touched upon that. The language courses were closed down. Our counseling services were closed down or had offered only a little services. And this was a problem when we think of issues like domestic violence, for example. Where do you go actually if you suffer domestic violence? If you think of immigrant families who live, well, normally in small departments, if you think of the refugee facilities where families live in one small room and have to share the kitchen and the sanitary facilities with a bigger group of inhabitants. So these issues were really very, very severe, and we involved all immigrant groups we have in Stuttgart, and especially, of course, the refugees. And the refugees started to sew masks, for example, for care homes, because this was again empowering people to do something to to contribute to the work we did at that time. We started with so-called bridging conversation, and we had no language courses. We couldn't offer language courses, and actually teachers called via WhatsApp the participants, the students, and talked German with them, so that they had forgot a lot what they have learned in their language courses before, but just to keep in touch and to learn German. So these are just a few examples. Another issue was at that time, you know, we, as Ms. Diehl said, we have no data on immigrants and COVID-19, which is good, because COVID has no migration background. But what we experienced in Germany, but also in other European cities, is actually a discrimination and racism against immigrants. When we think of the conspiracy theories, when we think that, you know, people from Asian countries were actually attacked in the beginning because they were the scapegoats, the spreaders of COVID-19. We had debates about the many Turkish people who celebrated wedding parties, bringing together many people who celebrated Eid or Ramadan. So they were actually the spreaders of COVID. So we had all these debates, but we in Stuttgart, we said, and also in other cities in Baden-Württemberg, it's not an immigrant issue. It's a societal issue, and we have to tackle that together, and we have to develop programs and initiatives to reach out to people, to communicate the right information, because many immigrant groups actually consumed information from their home countries. You know, in news in, I don't know, in Syria, in Iraq, or in Afghanistan. We had rumors about infertility affecting young people. So we actually had all these debates, and as the Department for Integration, we had to deal with that. So how to communicate the right facts to the different communities. And in this sense, it was also very important to involve the political level. This is, for example, our mayor for social services. She wrote a letter in different languages, and we disseminated them to the communities. And the response was that, wow, you know, there is a mayor who is caring about us. And this was very, very important to involve important persons known in the city administration to reach out to the different immigrant groups. So a very important issue, of course, education of immigrant kids. Homeschooling was not easy for them because we had also, like other cities, the problem with the technical equipment, so not enough hardware, not the right hardware for them. The immigrant parents actually couldn't support their children like German parents doing homeschooling. And it was also the immigrant families or parents who had no opportunity to stay at home and to work from home, because a bus driver cannot do that, a nurse cannot do that, a shop assistant cannot stay at home and sell from home. So all these issues were important to communicate in daily life. I will leave it with that, and looking forward to the questions.
Thank you very much, Ayse. And thanks to all the panelists. I think we have heard some fascinating information about some of the similarities between, especially at the municipal level, but also some of the important differences. Before we open the floor to the audience to ask questions, I wanted to give the panelists an opportunity to respond to each other. I think you must have had lots of questions and maybe comments. So giving you an opportunity to have a short conversation and ask any questions that you might have to each other before. We don't have a whole lot of time, just over 15 minutes, but if you could keep it brief, that we can then move on to the Q&A involving the audience. Yes, Claudia.
Yeah, I have a brief question to Ayse Özbabacan, because you mentioned, I found that really interesting, that you think it's good that we don't have data on the share of infections and vaccinations among immigrants. And I think it's really a double-edged sword, because on the one hand, I like your point to say, well, it's just our problem and we shouldn't differentiate. But then I think it's really important to know how much disadvantaged immigrants were and whether they, for instance, had less access to vaccinations and all that. Maybe you can elaborate on that.
Definitely. So on the one hand, it's good to have, data, or to know that indeed that immigrants are at higher risk to be infected by COVID-19, to show their living conditions, the situation they are in, what we were talking about regarding education, the job market, the living conditions, living in small apartments, small houses, and so forth. So in that sense, it's of course very, very important to show that, but also to show that they are a very important group in the pandemic, and they contribute to catch up with the crisis and to overcome the crisis. Many thanks.
I just wanted to make a brief comment on data. Data is critical, but how we use it is also extremely important. For me, as someone that's working as a practitioner, although I don't see migrants and newcomers, with the newcomer office does not provide direct services, data is critical for my work, because if I have data, then I can work to influence the city's policies, and through the city's policies, the provincial and federal policies. This data doesn't have to be broadly shared. For example, we have data on the differences as far as infection rates or vaccine uptake rates based on the different ethnic groups. That's not something that I think would be appropriate to widely publicize, in particular during the pandemic, but it's very useful data for us in order to plan services and to influence the decisions of the politicians.
So I have a question, especially in the way the relationship that came up in our discussion about the municipality and especially the regional scale of governance in the land in Baden-Württemberg, in the province in Ontario. And I would really like to hear from Ayse and from Vera how has that relationship from the municipal perspective. Were there any problems with this relationship? What was it? How has it unfolded during the pandemic?
Okay, I can start first. The relationship between the City of Toronto and the province has been very close prior to the pandemic, especially at the staff level. We, through various tables and committees, we have regular meetings. We exchange issues, ideas, information, and the City of Toronto always advocates on behalf of all of the migrants with the other two orders of government. Some of these discussions are available through various documents on the city's website, and I'm sure the provincial website as well. During COVID-19 in particular, the conversations between public health units and Ontario Public Health and the Public Health Agency of Canada have been very close. On the immigration side of things, we do have a very close relationship with both the province and the federal government, and there continue to be ongoing meetings, not only related to the impact of COVID on migrants, but also on immigration flows. And there was a mention, I was very interested to hear from Professor Weber about how COVID-19 impacted the immigration flows, and they in fact mirror what has happened in Canada. So in 2020, we have seen in fact a very sharp drop in migrant arrivals. So we are having discussions about that with in particular the federal government, and also about for example border reopening. So there's many other impacts of COVID-19 that we have been discussing with the other two orders of government that are indirect in a way.
So we, of course, have a close relationship with the Ministry for Social Affairs and Integration, especially when it comes to language acquisition, language courses, because we receive funding from the state government to coordinate the various language courses we have in Stuttgart. With regard to health services, there's a close, of course, was a close cooperation between our health department and the ministry regarding recent regulations and rules, and just to be to keep updated and to work together, and especially also regarding information in multiple languages. So there was a regular actually a regular exchange.
May I contribute something from the side of the ministry on that?
Yes, of course.
Yeah, it's actually in the way that Ayse described the situation. We were at a state level, Baden-Württemberg, very interested in keeping close contact to the cities and the communities, because we knew that this is where the actual work happens, not just integration in general, but particularly with respect to the COVID situation. So what communities could do and still can do is, for example, order medical teams that come to particular communities. And again, it's a peer group approach that people from the community try to distribute information and in the language of the community. So we have found out that it's important that you have people that have a testimonial status. It's important who is talking and who is giving information. So this is something that we did, and we handed out information material to the communities, and we also had conferences giving information and debating issues that take place in various communities, immigrant communities and refugee communities. So I think in a way we try to really work together hand in hand with the cities, with the communities, as a region, as a ministry. And of course, there are always things that can be improved, but overall, I would say working together was one of the success factors over time. Thanks.
Okay, well, thank you. And in the meantime, we have a few questions from the audience. One of them would be here, I'm just reading it. How can local public policies encourage non-status migrants to not be invisibilized as a consequence of the necessity of to present vaccine passports? And maybe pairing that with another question, whether municipal ID cards would be useful.
Maybe, do you mind if I start, Vera? I know we have slightly different views on the utility of ID cards for sure. ID cards are a bit of a tricky one. I mean, they seem to be used successfully in certain jurisdictions in the United States. But some of the reasons for that include that they're used widely within the community, whereas here in Toronto, and actually there's an ID card pilot program in Montreal, which is faltering for this reason, they're only used by non-status migrants. And so if anyone were to use a municipal ID card, it would basically be, you know, a badge of lacking status. And so you'd have to find a way to solve that piece and to have this ID card used for every resident, not just for those who can't get government issue ID. Like I said, in Montreal, they're starting very small scale version of this project, and we'll see in another few years whether they manage to get it off the ground and get buy-in from the rest of the community. My personal view is that this would be a very useful asset. It wouldn't on its own be sufficient, but it would be very useful. I think what really needs to happen, though, more fundamentally, is there needs to be an overhaul of our privacy legislation and system, which is a provincial, not a municipal area. And among other things, there needs to be a lot more clarity about how accountability occurs within privacy legislation right now. For example, if a hospital or other local public institution shares personal information, they actually don't have to keep a record that information has been shared with the CBSA, which is astounding to me. I filed 12 or 14 access to information requests in all of the local health units in Ontario, and I've got zero records of any information sharing, although we know that it's happening. So that needs to happen. I think when we speak with members of the government in Ontario, they view this as a niche area, not really a privacy law issue, but a migration issue and therefore a federal jurisdictional issue. And so they don't want to touch this. So I think for the vaccine passport approach, there needs to be a way of getting the public to talk more about the disproportionate implications that these policies have on non-status migrants. That's just not happening. And beyond that, I think more training would be really useful on the front line, especially within non-municipal local health institutions, health clinics, hospitals, etc. That's really been poor. Again, the local OHIP for All organization cold called almost all of the clinics in the Greater Toronto area, and of about 160 or so of them, maybe 30 recognized the existing policy of the province to provide healthcare without asking for OHIP. So this is a serious problem. It's not a legal problem. It's not a political problem. That's a training or awareness issue. So all to say, municipal ID card would be nice, but unless we tend to these larger structural issues, it's going to have a limited impact.
I will just briefly comment. There is a provincial ID card that was introduced a couple of years ago, and some undocumented migrants have been successful in obtaining it. And I think that's a much better approach than having a municipal ID card. One practical reason is that many undocumented live in one city and work in another, or travel, or so having a provincial ID card is much better. And my goal is to try and influence that it's obtained easier than what's currently the case. I also wanted to mention as a way to deal with this issue, our approach has been, and this is also responding to one of the questions related how the fund for migrants is being managed administratively. We contracted out a refugee center who is administering this fund. So working closely in partnership with agencies that are already in touch with undocumented migrants who are trusted by undocumented migrants, I think is the best approach. We don't need to have personal information on migrants, so it's with the agency that we contracted, and there's a very clear criteria, eligibility criteria to access this fund. So FCJ Refugee Center is administering that fund.
I just want to pick up on that and maybe hear from the Baden-Württemberg side about how important the population that doesn't have any status even is in the context of your policies. I understand there are very different status categories between Canada and Ontario and Germany and Baden-Württemberg. Is that even an issue, the non-status population?
We know so little about them. We don't even know how many there are, and there's very little research. I'm not aware of any qualitative studies looking at immigrant communities during the pandemic, but we sampled from the population register, so they are documented migrants.
And at the municipal scale, is this something that the city is looking at?
As Ms. Diehl said, we don't have data on that. We don't know the figures, so we just look at the documents. And we have many tolerated people, which is called Geduldete in German. So we have these figures, but we don't have other figures.
We're officially at the end of our time, and we still have one presentation. A short farewell. Is Professor Thomas Reith present?
Professor Thomas Reith, Honorary Consul of Canada in Stuttgart.
Hello to all of you. Good morning or good evening in whichever part of the world you are. It's a pleasure, and I would like to thank you for the invitation and the opportunity to join and to be part of this virtual meeting. My name is Thomas Reith, or Reith as one of you would pronounce it, and I'm the Honorary Consul of Canada in Stuttgart in Baden-Württemberg, our province. The COVID-19 crisis had and still has deep impact on all our lives, as you best know. However, it showed us that in both our societies and worldwide, the vulnerable and disadvantaged migrants and refugees are even more impacted than others. For example, with border closures, take Poland as a very bad example, housing and the deep impact on the children, as not being able to get fast access, if at all, to language and schooling. I strongly believe that joint efforts, innovative pilot responses, and systematic exchange of information and data can help improve the current realities and for many migrants and refugees. This symposium and exchange of experiences and ideas are important steps, maybe to find new ways to cooperate with different levels of difficulties in bureaucracy and integration. It's a pleasure to meet the organizers of the meeting, at least virtually, and extend a warm thank to you, Professor Harald Bauder. We know each other personally. Professor Birgit Locher-Finke, not yet, although they are located in Stuttgart, for the opportunity to get valuable insights today. And I would like to thank Vera Dodic and Professor Graham Hudson to share insights of the Canadian responses and practices during COVID-19 to minimize the impact of the pandemic to the migrants and refugees, sharing ideas for possible solutions in the future, as multiculturalism is highly celebrated, especially in Ontario, and the most probably in Toronto, as being called the most multicultural city in the world. I would like to thank Professor Claudia Diehl, as well as Ayse Özbabacan, I hope I pronounce her name properly, to outline different aspects, responses, and future ideas of improvements for local migrants and refugees in vulnerable situations in our province or state of Baden-Württemberg. As the Honorary Consulate of Canada in Stuttgart, we have not only provided during the COVID-19 crisis help and information to Canadians in order to ensure that did not slip into irregular status or provided sufficient resources to meet basic needs in Baden-Württemberg. We also provide information about the Welcome Center in Stuttgart, which advises and guides newcomers to different aspects of life in Germany. For example, employment, learning the German language, entry requirements, residence, healthcare, and of course, financial matters, not in terms that we pay, but that we advise a little to which people they could go. Once again, thank you very much to the audience, to the panelists, and of course, organizers of the meeting, Harald Bauder and Birgit Locher-Finke. Thank you so much to all of you. Goodbye.
Thank you, Professor Reith, for being with us and for your farewell note. I guess there is one or two more questions from the audience.
Okay, is anyone, you see the questions, does anyone of the panelists want to take one of the questions still that's out there?
I think it will be very difficult to answer this last question about the how the lives of Chinese immigrants in Germany changed, because there is, I mean, there are many surveys on how gender inequality increased and household division of labor, but the number of Chinese immigrants is so super small that I think it can only be done retrospectively by talking to Chinese family members in qualitative extended interviews.
And there's also a question about data sharing. How does data sharing work in Baden-Württemberg in Germany? And have there been any known issues of deportation based on health-related data sharing between provinces and municipal levels?
Maybe I can say a few words. Data sharing, that's actually a very difficult issue. We have the so-called Ausländerzentralregister, which is a big database where most of the administrative levels here who can access that database and what kind of data should be in there. Because there's also the other side, as you have discussed before, data can be critical to those people coming to Germany, and there is sensitive data that is also in that so-called Ausländerzentralregister. So that this data is shared from the federal level to the regional level, also to the city level, but only certain administrative branches can access it. And it is a political debate around that kind of data. But what I don't know, and maybe somebody else could help me, is the way in which the health data is shared there. I don't know anything about the health data. And I guess it's not part of that Zentralregister. And however, the link to identity and the past, what you have discussed in Canada is the same, but it's not part of that register or register as far as I know. But it's a critical issue because there are other data in there. For example, if people come to Germany because they're persecuted for their sexual orientation, for example, that kind of data is in there. This is critical data.
Okay, let me then hand it over to Birgit for a few final words.
Well, then I have to be really short now. Thanks, Harald. Again, I thought it was very, very interesting to exchange ideas, and I guess we had a good discussion, really pointing out what are the differences, what are the similarities, what can we learn from each other. First of all, I want to thank all the panelists for their time and for the presentation, and of course also the audience for the interesting questions we had and we could discuss among each other. But last but not least, I would like to thank the organizing team at Ryerson. That has been the main part. But I also want to thank Reith on my part, who has been key for having this symposium happen on the technical side. Again, thank you very much to everybody here. Thank you, Harald, for your initiative. And we have to see what we do in future and if we have more exchanges in that part. And I guess technically we can still learn some things here. But overall, I would say it worked out quite well. Thanks to everybody.